Thank you so much, everyone. Now, I would love to introduce to the stage Marjan, Yazdian, and Marjan will talk about comprehensive non-ablative laser skin rejuvenation using a novel 650 microsecond pulsed ND YAG. Welcome to the stage.
So that's go and that's back, if you want to go back at all. Yeah. Oh, you came from that.
Yes, that's good. Good morning. Thanks for having me. It was a great talk from Anita and Armenia. We're going to hear a lot today about fibroblasts and rejuvenation. I think most of us have had the patient that they come in to our practice and look at themselves and they say, I just look tired. I don't feel myself anymore. And the truth is, it's not always about one problem or one wrinkle. It's something deeper. Today I want to talk about how rejuvenation is changing from correcting what we see to understand what's happening underneath. But before we talk about the treatment, we need to understand the problem. When we are younger, collagen fibers are organized and strong. Elastin fibers are intact and resilient. The extracellular matrix is structured and efficient. Then something very rude happens. We age. Aging skin is not just about losing collagen. Fibroblasts also lose tension. Armenia explained very well. I'm just going to repeat because I think it's very important to understand the extracellular matrix becomes fragmented when we age. Collagen production drops. Elastin becomes disorganized. So the issue is not just a structure. The skin loses ability to function properly. How do we influence that process in a meaningful and biological way? And that's where laser technologies come in. Before we discuss rejuvenation specifically, it's important to understand why this device is so versatile. This laser works by targeting 3 chromosomes: hemoglobin, melanin, and water. So instead of treating just one problem, vascular, pigment, or texture, we are able to address multiple components of skin aging at the same time, like rosacea, post-inflammatory hyperpigmentation, melasma, specifically acne. We see a lot of that in menopausal women as well these days, eczema, psoriasis, and many, many other conditions. So that's important. I'm sure we all agree, because the real patient, they don't come to our practice with just one problem. So let's follow what happens after laser pulse enters the skin. The 650 microsecond pulse ND YAG wavelengths penetrates deeply into the dermis, while leaving the skin surface intact. The energy travels through the tissue. It interacts with multiple chromosomes, as we discussed. But for rejuvenation, the most important target is water within the dermis. This creates gentle bulk heating through the dermis rather than aggressive surface injury. That controlled thermal signal acts like a wake-up call for fibroblasts. Fibroblasts respond by initiating regenerative cascade. Then we observe increasing the production and organization of collagen and elastin fiber. Over time, the extracellular matrix become stronger, healthier, and more organized. This result is improved skin quality for sure, but this is not immediate effect. This is a biological process. This is where the difference comes in. The traditional NDX system rely on longer pulse duration, more heat, requiring epidermal cooling. However, the 650 microsecond pulse 1064 nanometer laser technology work different. Shorter pulse, higher peak power, deeper penetration more precisely to the target, and because the duration of the pulse is shorter than thermal relaxation time of the target, we see much less collateral damage. Therefore, there is no need for cooling or local anesthesia. Also, there is minimal to no downtime, which makes it safe across all skin types, including darker skin tone, and microsecond technology minimize the risk of complication, specifically post-inflammatory hyperpigmentation, which we all worry. In a real life, that means this treatment is fast, is practical, is very easy to integrate into your daily practice, because patient can return to their social life and work back to normal life straight away after the treatment. This study done by Dr. Kevin Pinsky, a dermatologist from Chicago. This was done in a controlled setting without combining with other treatment. So what we are about to see is the reflect and effect of the laser itself. As we see in this study, they include patients across range of ages, skin characteristic, treated with 650 microsecond pulse Nd:YAG laser protocol, and follow the patients over time. Patients receive an average 3.5 treatment, spaced 3 to 4 weeks between, and result satisfaction, it was more than 80%, medium to high satisfaction after the laser treatment. What makes this study practically important, it's that the improvement that they observed, it was getting better and better over the time. The study demonstrated measurable changes in the skin quality over time, supporting the concept of non-ablative regenerative laser is a process rather than temporary cosmetic effect. The finding suggests ongoing dermal remodeling beyond the treatment period, with continued improvement seen over the following weeks and months. This is an important concept because our goal is not simply create an immediate visible changes. Our goal is stimulate biological process that continue to improve skin quality over time. This is how I explain rejuvenation to myself and to my patient. At the baseline, both sides are the same. On the left, we have laser treatment alone, and on the right, laser combination with biostimulator like CAHA, radius, which means we are also introducing a scaffold that interacts directly with fibroblasts. Immediate after treatment, yes, there is some changes, but honestly, this is not the interesting part. Around 12 weeks, we start to see the biology, increased collagen production, increased elastin formation, angiogenesis, and ongoing extracellular matrix remodeling over time following the treatment. The skin begins to respond. Then at 6 months, this is where it becomes wonderful. Because the skin is not just recovering, it's organizing itself. Histological studies have demonstrated that collagen 3 gradually transitions towards collagen 1, elastin remain elevated, and active extracellular matrix remodeling continuing over time. This is where I believe combination approach, like adding biostimulator to the laser, can enhance the process. We're not just treating what we see, we are investing in how the skin behaves over time. I'm going to show you a couple of cases of myself and from my colleagues all over the world, but I want you to focus today on the progress, not perfection. Better texture, better tone, healthier looking skin, and importantly, as Anita mentioned, we all need something with minimal to no downtime in our practice. And this is what patient wants. So this case had 4 treatment Aerolase Neo, and as we see, beautiful texture, improvement in texture, and also the pigmentation after just 4 treatment. This is another case. At the middle, we see the patients 3 months after just using the skincare and work on a skin barrier, and then the last photo is actually after just 1 laser treatment, improvement in the skin texture. Same, another patient, middle photo is after using just a skincare for 3 months, and the last photo is after laser treatment, 1 session. She's my patient. She had the hybrid treatment Radius mixed with Revive, 1 session. And this photo is 3 months after her Radius, plus she had 2 session laser, and it's a month after the last laser treatment. Of course, with Radius, we usually advise the patient have 2 to 3 sessions a year, and with the Aerolase, usually it's 4 to 6 sessions to get the result that we want. So another patient of myself, and she had 1 session Radius hybrid treatment with Revive, and also she had just 1 session Aerolase Neo, and this is the result a month after the laser. This is a case of acne. As we see, significant reduction of active acne lesion, background erythema, and also improved the skin texture. Another case from the study, actually, improving active acne lesion, background erythema, texture, and scarring. And this patient just had 3 laser sessions. Another case from the study, acne patients, and we see improvement after 4 sessions. And this is laser only. He's one of my patients. I'm a fan of multimodality approach. So this patient actually had oral treatment, topical treatment, and 5-session laser with the gap of 2 weeks. And this is the result less than 3 months. Another case of melasma. We all know melasma is not curable. We can manage it. This is an incredible result with laser only after 4 sessions. The rosacea case, 2-session laser, of course, general, we have the protocol of doing the general passes and then change it to vascular for treating the rosacea, which is all coming like one laser where we can change the lens and do the vascular. And this is an incredible result after 2 sessions. So I will finish with this. Rejuvenation is no longer about aggressive correction. It's about intelligent stimulation, safer, more consistent, and more biological. And I think this is where the future is going. Not doing more, doing things better. The future of biohacking, it's not through the shortcuts. It's through the understanding biology and letting the science work quietly, the work for us. Thank you.
Thank you, Marjan. That was wonderful. Thank you, Marjan. That was incredible. Befores and afters are they're just so powerful.